Our next speaker tells us she's an optimist in life and enjoys a life with excitement. Helping her in her excitement are having two energetic children, and she tells me that they show her how beautiful life is and that it's worth fighting for. Unfortunately, in the past, she was also a cancer patient, and the challenges with communication that she experienced were what inspired her current research. From the Faculty of Arts and Design, please welcome Shara Ranasinghe.
Cancer is a leading cause of death in Australia, with 130,000 new cases being diagnosed this year alone. The impact of cancer is not only for the patient, it is for the family, friends, and for their health professional as well. The concept of PCC evolved in the healthcare system to support the patient and their loved ones with quality care. The two most important relationships for a cancer patient to perform PCC is with their health professional and their carer. The wonderful news is that proper communication can improve cancer patients' outcomes in satisfaction, adherence to treatment, and adjustment to their behavior and news. Now, the sad thing is that in reality, there is continuous dissatisfaction for cancer patients about the information and support that they're receiving. Therefore, my research focuses on enhancing patient-centered cancer communication during their cancer treatment. When I was going through treatment, I had a lot of support, but then I had a lot of doubts about surviving. Not that they didn't, it's because they didn't know what to say to me, and they didn't understand what I was going through. But I'm here today. It was not an easy battle. The point is, if I get $3,000, I can travel around and investigate the cause of this dissatisfaction and provide an effective path to perform PCC and let these cancer patients fight the battle of their life. Thank you.
Judges, do we have a question?
Thank you, yes. Thank you, Shara. Two questions. Who would provide the support to the patient the PCC, and also how do you get the clinicians to buy into that approach when delivering care?
Well, the proper PCC for a cancer patient is with the health professional. It could be the surgeon oncologist, it could be the nursing oncologist, or the physician oncologist. Also, the primary care provider who stays with them 80% of the time, because the patient has enough and more overwhelming news of dealing with the treatment as such. So it's the carer who's actually listening to what the doctor is saying. So these three need to work together, and that's what I'm fighting for with PCC. And I'm sorry, what was the second part of it? Oh, okay. And how do we involve clinicians? Well, now that's a trick, because I spoke to a few surgeons in certain conferences, and it's interesting, time is scarce for them. And for the clinicians, most probably it will be a fact sheet. But for a patient and a carer, it could be a digital app. So I need to investigate to find out what do they require so I could cater for their need. So they can be where I am today.
Thank you, Shara.